Okay. Can you please give me your initials?
G.A.
What is your primary language?
English.
Okay. What is your date of birth?
4/27/54.
That makes you 66.
Yes.
Where were you born?
Detroit, Michigan.
Okay. What gender do you identify as?
Female.
What race?
Caucasian or white.
What is your marital status?
Married.
Okay.
Mrs.
Okay. Do you have an ethnic or cultural origin?
No, I don't.
Fine.
No.
What is the highest level of education you've completed?
High school. 12th.
What is your occupation or profession?
Retired.
Okay. And what health insurance do you have?
Medicare and Medicaid.
Okay. And what brings you in today?
Hot flashes.
Okay. Okay. And when did this problem start?
At least 5 years ago.
Okay. Do you notice anything that brings it on? Anything that makes it better or worse?
When I lay down at night, always seem to get a hot flash. When I go to lay down to go to sleep.
Have you found anything that makes it better?
Not really. Just wait it out.
Alright. How would you describe the hot flashes?
Just a very warm feeling that comes over my whole body. Extreme heat.
Okay. And where do you feel it? Over your whole body, you said?
Yes, my whole body.
How would you rate the severity on a scale from 0 to 10? 0 being nothing, 10 being the worst that you've ever experienced.
Oh, I would give it a 7.
Okay.
When it happens.
Okay. How often do they happen?
Oh, I will say 3 to 5 times a day.
Okay. You said most of the time they happen at night. Do they happen during the day too?
Sometimes.
Okay. So what do you think that this means?
Going through my change.
Okay. Alright. So
Or getting old.
I'm going to ask you a few questions about your medical history.
Okay.
Your medical history, do you have any major illnesses during your lifespan?
No.
Any injuries?
Yes.
What were they?
I broke my left ankle and my left wrist.
Okay. Have you had any hospitalizations?
Other than giving birth, no.
Okay. Ever had transfusions?
No.
Any disabilities?
No.
When you were a child, did you have any illnesses as a child?
Oh yeah.
What were they?
Oh, I had chicken pox, measles. I was when I was 5 years old, I got a lot of colds.
Okay. Do you have any surgical history, like even for the ankles or the wrist?
No.
Okay. How many pregnancies have you had?
2.
Okay. Did they come full term?
Yes.
Okay. Any abortions?
No.
Okay. How many children do you have living?
2.
Your immunizations, how are those? Are you up to date on your immunizations?
As far as I know, yes.
Do you get a flu vaccine every year?
Oh, no, I don't do that.
Have you had a pneumonia vaccine?
Nope.
Have you had the COVID vaccine yet?
I am getting it Thursday.
Okay. Have you ever had a shingles vaccine?
No.
Any psychiatric history?
No.
Even as a child or adult?
No.
Okay. Any allergies?
Yes.
What are they to?
To sulfa, apparently.
What reaction do you have?
It happened when I was a child because of all the penicillin and stuff that they were giving me. They determined I was allergic to sulfa because I broke out in hives.
Any allergies to food?
No.
Any seasonal allergies?
No.
Okay. Are you on any medications currently?
No.
Any over-the-counter medications that you take?
Just vitamins.
And what vitamins do you take?
Multi and D.
Okay. Do you know the dosage of the vitamin D?
No, I don't.
How often do you take them?
Once a day.
For both of them?
Yes.
Do you remember the last time you had your physical?
Probably about 5 years ago.
When was your last eye exam?
I can get an eye exam every 2 years with this medication or with this insurance. So I had one probably about 1.5 years ago.
Okay. When was your last dental exam?
Oh, I had one just recently. I can't remember if that was before or after Christmas. I think it was after. I think in January.
Okay. When was the last time you had a pap smear?
Probably about 5 years ago.
Okay. Mammogram?
Same.
Cholesterol levels checked?
It's been a long time. Probably 5 years ago.
Have you ever had any cardiac tests done?
No.
Okay. Have you ever had a TB test done?
No. Well, when I was a child.
Okay. Any hearing exams?
No.
Let's see. So for your family history, do you have any family history with your grandparents, parents, spouse, or children? Any present illnesses with them?
No. My parents and grandparents are deceased. Children, no. They, as far as I know, have no illnesses.
Okay. How did your mother pass?
She actually passed from pneumonia.
How about your father?
That was 37 years ago, and we're not really quite sure. His body deteriorated.
Do you know how your grandparents passed?
No.
Any history of cardiac issues, diabetes, stroke
No.
with your parents or grandparents?
No.
Okay. Are you a U.S. citizen?
Yes.
Do you have any spiritual resources or religion that you practice?
Yes.
What is that?
Christianity, or belong to the Methodist Church.
And how do you view your health status?
I would say fair to good. Basically.
How's your appetite? Have you had any changes?
Oh, yeah, my appetite's good. Too good.
Are you satisfied with your current weight?
I'm sorry?
Are you satisfied with your current weight?
No.
Have you had any gains or losses recently?
Gains?
How much?
10 pounds.
Over how long?
For about 6 months.
Has there been any changes in your intake of food?
No, not really.
How are you with your drinking fluids?
You mean like water?
Mm-hmm.
Oh, I try to drink as much water as possible, but probably could do better.
Okay. Any issues with your bowel movements?
No.
Diarrhea, constipation?
No.
Incontinence, okay. Any issues with your bladder, burning, urgency, incontinence, foul odor of the urine?
No.
Any history of UTIs?
No.
Alright. And the home that you live in, is it in a city or rural?
Rural?
Is it a single family home?
Yes.
Do you know if there's any exposures to any environmental toxins where you live?
No, not that I know of.
And you said you're retired.
Yes.
Okay. Do you have any issues with performing daily tasks at home? Cooking, cleaning,
No, I just.
getting dressed, taking a shower?
Oh, no.
Okay. And then in your family, how are decisions made in your family?
My husband and I together.
Okay. Have you noticed any changes in like have you noticed that you've been more forgetful lately or anything?
No, that's been an occurring.
Okay. So no changes in your memory or speech or
No.
okay. And how much sleep do you get at night?
Not enough.
If you had to guess, how many hours?
4.
Okay. Do you take naps during the day?
Not usually.
How many pillows do you typically use to sleep?
1, but I have 2.
Okay. Do you take any sleep aids to help you with sleeping?
No.
Okay. Do you have a hard time falling asleep, staying asleep, both?
Falling asleep.
Okay. What kind of exercise do you do, if any?
Well, I was walking.
Okay. How often?
I was doing about 4 days a week. But
And how?
I hurt my ankle, so.
And how long are your walks when you do go, typically?
Oh, about 1.5 miles.
Okay. Do you exercise enough to get your heart rate up?
Probably not.
Do you have any hobbies? Anything that you like to do for fun?
Yeah, I like to quilt.
Okay. Have you done any traveling?
No.
Okay. Any use of cigarettes, drugs, or alcohol?
I like wine.
Okay. How often do you drink?
Oh, I'll have maybe a bottle a week.
All at once or spread throughout?
Spread throughout.
Any issues with your partner and violence?
No.
You feel safe in your home?
Oh, yeah.
Have you had any major life change in the past 2 years?
Other than retiring.
Does that make you feel more or less stressed?
Less stressed.
Are you sexually active?
Yes.
Okay. Do you prefer men, women, or both?
My husband.
Has anything changed about your sexual health or function?
Less active, put it that way, I guess.
Okay. Have you had any changes in your feelings of fatigue, weakness?
Yeah, I get tired.
Okay. Have you had any fevers?
No.
Okay. Any issues in your skin, rashes, lumps, sores, itching, dryness, color change?
Dry skin, that's about it. But, that's with the seasons.
Any change in your hair or nails?
No.
Okay. Any issues with headaches?
No.
Any head injuries?
No.
Dizziness or vertigo?
No.
Any changes in your vision?
No, not really.
Do you experience eye pain, redness, or swelling?
No.
Any wear corrective lenses, it looks like?
Yes.
What kind?
Bifocals?
And when did you say your last eye exam was?
About 1.5 years ago.
A year and a half ago. Okay.
Yeah, so.
Okay. Any issues with having double vision, blurred vision?
No.
Any history of eye cancer?
No.
Okay. Do you experience any dryness or excessive tearing?
No.
Okay. Any changes in your hearing?
Am I hearing?
Mm-hmm.
No.
Okay. Any ringing in your ears or earaches?
No.
Any history of ear infections?
No.
And you haven't noticed any discharge coming from your ears?
No.
And you don't use hearing aids right now?
No.
Okay. Let's see. Do you have any issues with colds recently? Congestion, nasal obstruction, any discharge,
No.
itching?
Mm-mm.
And you said you didn't have any seasonal allergies, right?
Correct.
Any issues with nosebleeds?
In the wintertime when it's dry.
Okay.
Yeah.
Any changes in your sense of smell?
No.
Any sinus pain?
No.
Okay. Have you experienced any bleeding of your gums?
No.
Any mouth pain, toothaches, any lesions?
No.
Okay. Do you wear dentures?
No.
Okay, and you said your last dental exam was in January, right?
Yep.
Okay. Any dry mouth, sore throats,
No.
hoarse throat, or hoarse voice?
No.
Do you still have your tonsils?
No. I do not.
Have you had any change in your sense of taste?
No.
Do you have any lumps or anything that you notice in your neck?
No.
Any tender areas or swollen areas?
No.
Okay. Any stiffness or range of motion that's changed and limitation?
No.
Have you noticed any pain or lumps or discomfort in your breasts?
No.
Any discharge from your nipples?
No.
Okay. And have you had any surgeries on your breasts?
No.
Okay. Any history of cancer or mastectomy or biopsy?
Oh, no.
Okay.
With myself?
Yes.
Oh, no.
Have you experienced any coughs recently?
No.
Okay. Any shortness of breath or wheezing or trouble breathing?
No.
Okay. And you said you have not had a TB skin test, correct?
Just when I was a kid.
Yeah, that's where they
Right.
inject underneath your skin and do the little bubble.
Yeah, I remember that being done when I was like probably 60 years ago or
Okay.
55 years ago or something.
Do you remember the last time you had a chest X-ray done?
For like if I had a cold or something.
Yeah, just in general.
No, I can't remember.
Okay. Any chest pain or discomfort?
No.
Okay. Do you ever feel any palpitations or shortness of breath?
No.
And do you ever have swelling in your feet?
Swelling in my feet?
Mm-hmm.
No.
Okay. Let's see. Do you have a history of hypertension, high blood pressure?
No.
Okay. Have you ever been told that you're anemic?
No.
Okay. You said your appetite is still intact.
Yeah.
Any issues with being nausea, vomiting, heartburn?
No.
Okay. Any pain in your stomach?
No.
Any issues with belching or flatulence?
I guess every now and then.
Okay, but nothing out of the ordinary.
But no, I wouldn't
Okay.
say so.
And no change in the bowel habits overall.
No.
Any issues with hemorrhoids?
No.
Okay. Is there any foods you intolerate or don't tolerate well?
That I don't tolerate well?
Mm-hmm.
I can't think of any.
Okay. Have you ever noticed any yellowing of your skin or eyes?
No.
Okay.
Oh.
Okay. And how often do you urinate, would you say?
Oh, often?
Does it coincide with how much water you're drinking?
Sometimes.
Okay. Do you have any issues with incontinence?
No, not really.
Okay. Are you taking any kind of birth control methods?
No.
Okay. Any HIV exposure?
No.
Okay. Are you still having periods?
No.
Okay. Do you ever experience any bleeding?
No.
Okay. Any itching, discharge, sores, or lumps?
No.
Any pain during sex?
No.
Okay. Do you notice any coldness or tingling or numbness in your hands or feet?
No.
Okay. Any issues with leg cramps?
No.
Varicose veins?
Yeah, I've got some of those.
Okay. Just in your legs?
Yes.
Any history of blood clots?
No.
Okay. Do you have any discoloration in your hands or any ulcers on your hands, legs?
No.
Do you experience any muscle or joint pain or cramps?
No, not really.
Any joint stiffness?
No, I guess maybe a little bit because of my age.
Okay.
That's about it.
Does it affect your daily life?
No, it does not.
Any history of gout?
No.
Any history of disc disease?
Of what?
Disc disease, of discs in your back?
Oh, no.
Alright, any history of seizures at all?
No.
Okay. Have you ever had any syncope or collapse?
I'm sorry?
So dizziness or collapsing?
No.
Okay. Any vertigo?
No.
Never had a stroke?
No.
Okay. Any tremors that you've noticed?
No.
Okay. And no history of mental disorders or hallucinations?
No.
Okay. Okay. Would you say you bleed or bruise easily?
No.
Okay. And you said before that you have not had any blood transfusions, correct?
Correct.
Have you noticed any swelling in your lymph nodes?
No.
Okay. And you said you haven't had any exposure to any toxic agents, correct?
Correct.
Okay. Do you say that you tolerate heat or cold well?
Yeah, I don't like being cold. And I don't like being overheated either.
Do you ever experience excessive sweating?
No. Oh, no.
Okay. No history of diabetes. Do you have any history of thyroid issues?
No.
Have you ever used hormone replacement therapy?
No, I have not.
Okay. Do you experience any nervousness or anxiety?
No.
Any issues with depression?
No.
Okay. And no history